Hi, my name is Tara Moorhead, Director of Community Outreach for Ridgecrest Regional Hospital. Thank you for joining us for our very first Virtuell Health Series. Virtuell is a virtual monthly health series that we will be bringing straight to you in your home. Today we are very excited to have Ravneet Sohal discuss with us about heart health. Being proactive about your health is very important, especially today, and nutrition can be a huge part of being healthy and staying healthy. Rav is a certified clinical health coach and a certified lifestyle medicine professional, and we are very excited to have her here today.
So what we're going to be doing is we're going to be starting off with adding some olive oil into the pan. We're going to start with 2 tablespoons of olive oil. And as we create or make our chickpea curry, we're going to be talking about the research behind all the ingredients. So here's 2 teaspoons of olive oil. Olive oil is very high in omega-3 fatty acids, which is very good for you. Research actually has shown that if you take 1.5 tablespoons of olive oil a day, it can decrease your risk of CAD, coronary artery disease. So now we're going to be putting in 2 medium onions. So what I did was I took 2 medium onions, I chopped them up. And onions are also very good for you. They actually have something in them called prostaglandins. Actually, it's prostaglandin A1. And prostaglandin A1, what it does is that it dilates your arteries. And once your arteries get dilated, that kind of helps with the blood flow, and it's actually proven to decrease your blood pressure. Onions also have been linked to decreased blood pressure by a bioactive component called quercetin. And quercetin has also proven to decrease your blood pressure. Onions also, another fun fact about onions, is that it actually gives you 13.11% vitamin C, which is your 13.11% is your daily intake that's recommended by the 2015 to 2020 American Dietary Guidelines. So a lot of nutrition in these onions. And what I'm doing is I'm just, sauteing them until they turn a little brown. So what we did was we added olive oil and onions. Olive oil as well is very good for you. It also contains vitamin E and antioxidants as well in it, which is very good because it has proven to decrease your proven to decrease your LDL, which is your bad cholesterol, and increase your HDL, which is your good cholesterol. Try cooking with some heart-healthy oils. Some of them are sunflower oil, flaxseed oil, avocado oil, and those are all very good oils to cook with. So we're just going to wait until these onions have turned a little brown. And once they do turn brown, what we're going to be doing is adding the garlic. Also, olive oil decreases your triglycerides, and it's also proven to decrease inflammation. And that's because of the omega-3 fatty acids. So it decreases your inflammation, and it prevents arterial buildup of plaques as well. And again, you'll be seeing the references at the end of this video. So you can actually go ahead and find the articles online and read them as well. So I just put in some garlic, and what I wanted to tell you, a fun fact about garlic, is that the American College of Lifestyle Medicine has done a research and proven that garlic can actually decrease your blood pressure by 8 points. Also, a study was done in 2014 that proved that there were 2,300 individuals that were enrolled. This was a meta-analysis that was published. And these 2,300 people were given garlic, and what happened was they gave them garlic for a minimum of 2 weeks, maximum of about greater than 2 months. They gave them garlic, and their cholesterol was already greater than 200. Their total cholesterol was, and just by taking garlic, their cholesterol went down by 10%. Their total cholesterol and their total lipid levels. The total cholesterol and their LDL went down by 10% just by taking garlic. daily. So garlic's very good for your blood pressure. Next, what we're gonna do is we're gonna be adding ginger. And here's the ginger. And this is basically a medium-sized ginger root cut in half. That's what I used. And so we're gonna put it in here. So far we have onions, garlic, and ginger. Ginger is very interesting. It comes from, it has a special ingredient in there called gingerol. So gingerol is actually found in the root of ginger. And like it's a bioactive component of oleoricin. Oleoricin is found in the root of the ginger. Within the oleoricin, there's something called gingerol. Gingerol is actually kind of like magical. You know, it's an antioxidant, it's an anti-inflammatory, it decreases your blood pressure, it decreases your lipid levels, your cholesterol, and it has actually, there was a study done, interesting, another heart healthy fact, that it actually helps with diabetes. A study was done where they injected mice with gingerol and with ginger, and they noticed that the insulin levels on these on the mice got higher, so they had a higher insulin level, and they had better regulation of their glucose, so better glucose tolerance. And this is a very interesting study on ginger. Ginger has also an antiplatelet effect, which is very good for cardiovascular disease. So eating ginger every day is very good for you. It also is good for nausea, because it has an anti-nausea effect. And it also has an anti-carcinogenic effect as well. So as you can see, I'm going to continue cooking the onions, garlic, and ginger until the ginger has softened. So it hasn't softened quite yet. And we're going to just keep stirring and mixing it, sauteing it. You can really smell the aroma right now. Okay, so now the next step is going to be to add some spices. As you can see, we have these 4 spices that we're going to be adding. We're going to start with cumin. So with the cumin, we're going to put in 4 teaspoons of cumin. Cumin has flavonoids, terpenes, as well as alkaloids, and all of these are very good for you. What they have done is that studies have proven that they've been very effective with decreasing LDL levels. Very effective with LDL levels. So that's 2, and we're going to do 3, and 1 more to make it 4. You can really smell the cumin here. And now we're just going to mix it up a little bit. And while I'm mixing this, what I want to do is I just want to lower the temperature a little bit just so it doesn't burn as I'm mixing it. Okay. And we're going to just keep stirring until it's all mixed in there, until all the onions, until all the ginger and all the garlic is mixed in with the cumin. A study was done with cumin that involved obese women that had high cholesterol, LDL, high LDL levels, and they took 1.5 teaspoons of cumin every day, twice a day. And so they ended up having a decrease, and they did it for 3 months. They did it for 3 months. They took 1.5 teaspoons of cumin for 3 months. And they ended up having a decrease in weight, decrease in BMI, a decrease in their LDL levels, a decrease in their triglyceride levels, as well as a decrease in their total cholesterol. So the cumin has all these, the phenol, the alkaloid, the flavonoids. All those are excellent antioxidants. And that's why it's helped with LDL levels, it's helped with weight and BMI. Cumin also is an excellent anti-inflammatory as well. So now, next what we're going to do is we are going to put in our coriander. And we're going to be putting in 4 teaspoons of coriander as well. There's 1. There's 2. 3, and 4. So 4 teaspoons of coriander. And with coriander, no significant research has been done that's proven that it's been has any effects, but it has been said that it is effective with controlling blood sugar levels. All right, next what we're going to do is, once this coriander is all mixed in, we are going to add turmeric. And turmeric is going to be about 3 teaspoons of turmeric. Okay, so here we go again. Here's 1, 2, and 3. And again, what we're going to do is just mix the turmeric in there. So turmeric is very healthy for you. It has something in it called curcumin. And a very interesting point, a heart-healthy fact about curcumin is that it helps you with your blood flow of your arteries. And why is that, you might ask? Well, the reason is because what the curcumin does, it improves the endothelial lining of your arteries. And what that does is that it helps the blood flow. So it helps blood flow through your arteries because it works on that endothelial lining, improving it. And this improves, your cardiac health. What it does is it helps with your blood pressure, your cholesterol. It decreases your risk for atherosclerosis. It improves the blood flow in your arteries. And it's also proven to decrease cholesterol levels as well as triglyceride. Okay, and next what we're going to do is we are going to add some cayenne pepper. So we're going to just put 1 teaspoon of cayenne pepper. Okay. As well as some green chili. This is 1 green chili pepper that I am going to add in here. And with the green chili, it has something in here called capsaicin. Capsaicin is what it gives that spiciness. And that spiciness is very important because that capsaicin, what it does is it works with receptors. It works with receptors in your body, and it regulates receptors in a way that it actually, again, causes vasodilation. And this actually helps, again, vasodilation, helps with your blood pressure, helps with your blood flow. So chili is actually very good for you. And a lot of heart-healthy facts today for you. Capsaicin also, and remember that's the ingredient that's found in the chili and the peppers, it also helps with atherosclerosis, with strokes, with hypertension, with obesity, with cardiac hypertrophy. So it helps with all those cardiac conditions. So next, what we're going to be doing is we're going to be adding some salt. Now, salt, you need to be very careful with salt, especially if you're a cardiac patient. Here we have the salt. Now, in the 2015-2020 dietary guidelines say that your average adult should take in 2,300 milligrams of salt a day. And that is about 1 teaspoon. Now, this over here is half a teaspoon. Half a teaspoon is what CHF, congestive heart failure patients, should take. So CHF patients should only take half a teaspoon, which is 1,500 milligrams of salt. But today what we're going to do is we're going to be putting in even less than that. We're going to be putting in a quarter teaspoon. So we're going to be putting in a 1/4 teaspoon today, which is less than what's recommended for CHF patients as well as for our average American diet. So there we go, a 1/4 teaspoon of salt. And we're going to stir that in there. Okay. So next, what we're going to do is we're going to add the tomatoes. And now it's getting a little dry, which is fine because the tomatoes will give it some water. So you're going to notice that it is kind of dry, but smelling good. Smelling good. All right. So here are tomatoes. What we did was we used 1 chopped tomato. So we're gonna put that in here. Okay, and this tomatoes contain lycopenes. And I'm just gonna keep stirring this. So tomatoes contain lycopenes. Lycopenes are found in the cell wall of tomatoes. And what makes this very special is that the more you cook the tomatoes, the more lycopene is released, which is very good. So these lycopenes, what they have done is that studies have proven that they prevent your arteries from thickening. So that's your fun, heart, healthy fact. And they also have an anti-thrombotic effect, anti-platelet effect, which is very good for blood flow. And also these tomatoes, they also have potassium as well as vitamin B. And this again is very good for regulating your cholesterol levels as well as your blood pressure. So these tomatoes are very good at decreasing your risk of coronary artery disease. So you're gonna notice that all the ingredients that we've used, they have some sort of some nutrient, some evidence-based research behind them for good, for benefits of your heart. So every single ingredient that we've used has some sort of a cardiac benefit, a health benefit. And that's why in lifestyle medicine, it is said that food is medicine. As you can see, a lot of these ingredients that we use, you know, you can get them from the grocery store, and they all have excellent health benefits. And all of them are heart healthy, all these ingredients. All right, so what I'm doing is I'm just stirring it all right now, making it all cooked. Again, the more I cook the tomatoes, the more lycopene gets released, and more of a benefit you will get with the effects of the lycopene, which is found in the cell wall of the tomatoes. Okay, so since it is drying up a little bit, what we're gonna do is, and this is a part of the recipe as well, to add 1/2 cup water. So here's your 1/2 cup. It's starting to smell very garlicky, oniony in here now. So we're just gonna let this kind of, you know, absorb for about 30 seconds or so. Just wanna kind of give it some moisture. All right. Okay, now next what we're gonna do is we're gonna add our chickpeas. These are chickpeas that have been rinsed. Now remember, if you are eating chickpeas from a can, please make sure that you rinse them, because there's a lot of salt, there's a lot of sodium, you know, that's in canned chickpeas. So please rinse them thoroughly. These have been rinsed very thoroughly, 2 cans of chickpeas, and we're now going to add them in here. Okay. Now we're going to mix this up. Chickpeas are very high in fiber. Remember, any food that's high in fiber, and this has been proven by studies, any food that's high in fiber will lower your cholesterol, and it will also regulate your sugar levels. So I am just going to mix these chickpeas into the onion mixture that was in here, and it looks really good right now. And chickpeas are high in omega-3 fatty acids as well. So that's very good. Good for your, again, same thing, good for your cholesterol, good for your blood pressure, you know, good for your digestive tract because it has fiber in it. And that's just your rule of thumb there with chickpeas. So I'm just gonna keep stirring it, keep mixing it up. Now some people can, you know, like to make it very curry style, so you can always add more water to make it more runny. Maybe if you want to eat it with rice, you can make it a little bit more watery by adding more water. Or if you want to make it kind of like a dipping sauce, like with chips or with like a pita, or, you know, with like a wrap, you know, lettuce wrap of some sort, then you can make it like how I did, a little drier. So it's not that, you know, runny. It's not that liquidy. And we're just going to continue mixing. The reason why I keep mixing it is so that it doesn't burn. Another quick fun little fact. The chickpeas are high in calcium, potassium, and magnesium. And because they are high in those, in the potassium, calcium, magnesium, that's what helps lower the blood pressure. Back to cumin, by the way. A quick fun little fact about cumin. Cumin actually has antibacterial effects, antifungal effects. Back in the day in India, they used to use cumin for antibacterial and antifungal effect, and that's because of the cuminaldehyde, which is found in the cumin. And I'm going to just keep mixing, and as I'm mixing, I'm just waiting for the chickpeas to soften. Right now it's a little hard, but you know, in about maybe 10 more minutes, the chickpeas will soften, and then we'll be all done. So what we're going to do is we're going to be adding the cilantro, which is the last ingredient to our chickpea dish. And here's the cilantro, and it's a 2/3 cup of cilantro, which I'm going to be putting in here. And then we'll just mix it in. Okay, so you can see a little bit of green. This is very colorful. You have some red from the tomatoes, you have the green from the cilantro, and the yellow from the turmeric. So it's a very colorful dish here. Okay, we'll just let that sizzle for a little bit. Okay, looks like our chickpeas are done. Now there are several ways to eat this. You can eat these chickpeas with quinoa, with rice, in a lettuce, as a lettuce wrap, with pita. You can even put a spoonful of it on top of nachos and have it as a topping for that. But today we're going to be making lettuce wraps. So here's our romaine lettuce and pita as well. So what we're going to do is we're going to take one romaine lettuce like this. We are going to take the chickpeas, just top it off like this. You can even put some fat-free yogurt on top to give it some, you know, some softness to the spiciness. And here's a pita as well. And again, you can just put pita on top of it, pita to the side, however you like it. And there you go. These are your two ways of eating the chickpea dish. All right, well, thank you so much for joining me and for making this dish with me. I also just wanted to say that including these heart-healthy ingredients such as the onions, the garlic, the ginger, all the spices, the cumin, the turmeric, the tomatoes, all of these spices, all of these ingredients, they are just, you know, small little ingredients, small specific changes that you can make to your diet every day. Adding maybe a little bit of garlic every day, adding maybe a little bit of ginger every day. Just making these small changes to your daily lifestyle can really help prevent coronary artery disease. You know, it can help regulate your blood pressure. It can help regulate your sugars, your cholesterol. So, you know, you can really take care of your health just by making small specific changes with your eating habits, such as how we did today. So I hope you enjoyed this video. What I'm going to do now is have Tara here come join us, and please try our dish.
Well, I am very excited to give this a try because, as Rav said, it does smell amazing. And all of this information has been approved by our board certified cardiologist at Ridgecrest Regional Hospital, Dr. Mosen. And you also can find all of the references that Rav mentioned throughout her presentation on our website, along with the recipe. All right, here we go. This is amazing. I hope you guys give it a try and that you have enjoyed our first Virtue Well Health Series. We're gonna start, hold on, this is
scared me. My face. But this stopped sizzling. Did it turn off? Oh, because it unpaused.
Rav is a certified clinical health coach and a certified...
1 second, it unpaused
I
again.
was almost wondering something. Sorry.
No.